Hey, everybody. On day 5 of the James Craig trial, I'm going to tell you what some of the treating physicians and nurses had to say about the rapid decline of Angela Craig that last day of her life, March 15th of 2023. We're also going to hear from a friend of Angela Craig's, and we're going to hear from some toxicology experts and the medical examiner regarding cause of death. Lots to get to right after you watch this intro. I'm going to tell you all about it. Hi, everybody. Welcome back to the channel. I'm Rebecca, your host of Crafting and Crime Daily, and I'm currently covering the trial of James Craig. He is a dentist in his late 40s now, and he is accused of and charged with the murder of his wife, Angela Craig. They had been married for 23 years. They had 6 kids. He was in a dental practice in a large town called Aurora, Colorado, outside of Denver. But we've heard from his business partner. We've heard from some friends. Today we're going to hear from some treating nurses and physicians about the last day of Angela Craig's life. But before we get into it, if you wouldn't mind hitting that thumbs up button, it helps YouTube push this out to other people. And subscribe. I don't charge a thing. It's free. And if you're already subscribed, become a member of the channel. I might start doing members only lives on Wednesdays. Instead of the Craft With Me Wednesdays, I may go to a Wednesdays only, members only live format. I'm considering that. So just saying. Just giving you the heads up. So what happened on day 5 in the courtroom? James Craig charged with the murder of his wife. It's alleged that he poisoned her with cyanide and tetrahydrozoline, which is the active ingredient in Visine eye drops, and very toxic if you ingest it. You're not supposed to ingest it. Just put a drop or 2 in your eye. In any case, the first person on the stand is a woman named Nicole Harmon. Now, Nicole and Angela became friends because their husbands grew up together and were now going to dental school together. So they became fast friends. They bonded over raising their children together. But as the children got older, they got further and further apart. And there's an incident that happens in 2019 that kind of solidifies that wedge where they kept getting further and further apart. In any case, and we're going to talk about that 2019 incident. But they all moved out to Colorado. Now, she knows the Redferns, and she said her husband went out and he actually became an employee of Dr. Craig's practice. She said Angela Craig is not a risk taker. She is not a manipulative person. And on March 9th of 2023, this all happened 2 years ago, she gets a communication from Angela Craig saying, can you come to my house and test my blood sugar? Now, the reason Angela is asking her friend Nicole is because Nicole's child has type 1 diabetes, which probably means she's got one of those discs that go in your arm. I don't know what they're called. That monitors your blood sugar pretty much continuously. I doubt that she has like the fingers dip blood. She might for emergency purposes, but in any case, Angela's thinking, okay, this woman knows all about diabetes. Let me get her over here. And so she comes over, and she knows nothing about what happened on March 6th, with the protein shake and the bike ride and the hospital, and she didn't know anything about that. But on the 9th, she gets there, and Angela Craig is sitting on the couch watching cartoons with the kids. She said she really looked ill, that she said she hadn't slept well, and that she had been for a bike ride that morning and then came home sick. And then she'd been to urgent care and they couldn't find anything. So she said, maybe I'm having some kind of diabetic episode. So Nicole noticed that on the side table of the couch, there was a protein shake sitting there. And she's like, oh, yeah, James made me this protein shake this morning. So Nicole says, why don't you just eat some crackers to get your blood sugar, keep your blood sugar up? Now, I never heard if there was testing that was done. Was it done? Was it not done? It sounds like she did not do any testing, and the reason for that probably is she doesn't have good stuff to do it with. I don't know. She didn't do any testing that I'm aware of. So she leaves to take her daughter to school, and then she picks up some soup and she heads back to the house about 11:30. And Angela's gone. She went to the hospital. So she gets texts. She's texting with James Craig. And James, she says, wow, what the heck? You got any ideas what might be going on? And James says to her, it's the Rona. What? It's the Rona? This is 2023. I mean, I guess that's possible. But anyway. So that was on the 9th. Then she gets a text from James Craig on the 10th saying, Angela doesn't have diabetes, and they don't have any idea what's ailing Angela Craig. She also gets communication from Angela Craig saying, yeah, I'm in the hospital, and no, they don't know what's wrong with me. So then she was asked to describe this whole 2019 incident when apparently the Craigs were over visiting with the Harmons. I don't know how this came up, but James tells them he is suffering from a sex addiction, and that it had gotten to the point where he was considering taking his own life, and that he was having those thoughts. And then he described that there was one night where he was planning to inject himself with something to kill himself. So he drugged Angela so that she would fall asleep and not wake up and stop him. Now, Angela has never mentioned this incident to the Harmons, but this is something James communicated to them. So Angela Craig said she's going to stay in the marriage. I'm going to stay in the marriage. I'm going to help my husband. We're going to go to counseling. We're going to therapy. After that, they didn't talk with them so frequently. So the next person I'll see it is a nurse of 23 years, Kristen Abakan. I can't say the name. I apologize, Kristen. She was treating Angela Craig when she was critically ill, and she is the one that one of the people that collected blood samples. So she said she had several patients that day, but as soon as she walked in the room with Angela Craig, and we don't know, I didn't get a date, a time, I don't know what, frame for this testimony, but she said following her entry into the room, so it had to be March 15th, she says Angela Craig became the only patient she took care of that day. She was that ill, so it had to be the 15th. So then we hear from a pulmonology doctor. Pulmonology and critical care. These are the guys that are usually hired to run the ICU and manage critical care people in the hospital. So she is in the ER on March 15th, and she's incredibly sick. But he said initially her exam was pretty normal, and her lab results were normal, so they were getting ready to discharge her when all of a sudden she just becomes drastically ill. Her blood pressure drops, her oxygen levels drop to the point where they have to intubate her. And she was unresponsive. She was basically comatose and so unstable that this doctor was afraid. This is when he was asked to step in because, now they've got this critically ill patient. Hey, pulmonary care, critical care doctor, can you help us out here? And he steps in and starts managing her care. But he said she was so unstable, he didn't even want to transfer her to get a CT scan of the brain. But he needed that information, so he did it. And the CT scan showed severe brain swelling. So his thought here was it had been reported to him that James Craig had been in a lone had been alone in the room with Angela, had come out of the room saying that Angela was having arm pain, and he did it in such a fashion that it made everybody feel like this was something urgent, and they all rushed into the room to find her unconscious. So his question was like, could someone with that much brain swelling complain about their arm hurting? But he did have to admit on cross-examination that he didn't know how fast the brain swells. So maybe she could complain about how her arm hurt and then have brain swelling. I don't know. So they also did EKGs. Heart attack was ruled out, but they did take her to the ICU following the CT scan. She goes to the ICU. They drilled a burr hole in her skull to relieve the pressure, and they discovered at this point she's got no blood flow to the brain. So he decides at this point, okay, I gotta go deliver the news to this husband that the outlook is not so good here. So he finds James Craig in a conference room with a bunch of other family and some friends, and he gets him aside and he says, she's brain dead. And he said it was a very lackluster response, considering, you've got to understand that he comes in and she's normal, and the next thing someone's telling you your wife is brain dead. Like, you need time to process that. And he didn't seem to be processing it. He just said, well, she wouldn't want medical intervention at this point. It's not going to make a difference. Well, he had been told that medical intervention at that point would not make a difference. And then he says his wife wouldn't want the medical teams to continue to work on her, which he thought was a very strange response. Usually the response you would get is someone that's going through this in early stages of a grief process. They're in shock. They're in denial. They're angry. They're working through all these emotions. Not James Craig. No, she wouldn't want any more medical treatment. So it's at this point in the care of Angela Craig that this doctor is informed by a nurse about the conversation she had with Dr. Redfern about a package of cyanide being delivered to the dental office for James Craig. So immediately, this physician, the pulmonologist, gets some toxicology specialists on the case. He immediately gets the specialists on the case, and they administer an antidote. But it's too late. They also draw her blood. In any case. So the next person on the stand is Rose Spichala. Really cool name. So she's another nurse. She's working in the emergency room when Angela came in. Angela was dizzy, but she could walk. She walked into the nursing room. Why am I going to say nursing home? She walked into the hospital. She walked into the emergency room. And she remembers, she was starting to look better. Her demeanor was starting to change. And then this nurse leaves the room. James Craig enters the room. Then later comes out of the room saying his wife's arm is hurting. And she said that he said it in a very panicky way, causing everybody to rush into that room. And they find her unconscious, but kind of having like seizure-like activity. So they pull the alarm and I imagine call, but I don't know if it was a code blue, but whatever code it was. And she draws blood at 11:50, and we're going to tell you what the results of that blood were before the end of the show today. But now here's the strange thing. James Craig, well, the hospital personnel have rushed into the room to take care of your wife. Picture yourself in this situation. Your wife comes in normal. All of a sudden, she's crashing. People are doing whatever they can to save lives. I've been in that situation many times. I can tell you it is chaos when one of these codes are going on. There's tons of people in the room. There's 40 things going on. This guy, James Craig, instead, I would be gobsmacked. I'd be, even at me, who's a medical personnel, this is my loved one, my jaw would be on the floor. And I would probably be asked to leave the room. He is outside the room, looking in, taking pictures. Okay. So in this case, the jury is allowed to ask questions, and they did. They're like, "Have you ever seen that before? Has a family member ever taken pictures during an emergency care before?" And he's like, no, no. What? Yeah. All right. Then we have an expert toxicologist, Carla Walker. She was given 2 different blood samples, both taken on March 15th. The I don't have the time on here for the blood samples, but the first sample that she received, she tested for cyanide. It came back 5.865 milligrams per liter. Now, she explained that in a non-smoker, a non-toxic level of cyanide would be like 0.025. And if you have some sort of exposure, maybe you're exposed to cyanide at work, a non-toxic level will be considered 0.2. If you're anywhere from 1 to 2.5, you're probably in a coma with respiratory depression. In other words, you're not breathing the way you should. Over 3 is certain death. She was 5.865. 5.865. Twice what it takes to kill somebody. And pretty rapidly, I might add. And then the second sample was 4.770. So then we get a person named by the name of, oh, there was one thing I skipped. Did I skip it? No, I haven't skipped it. Okay. We're going to get there. Anyway, next one is Justin Brow. He's a forensic toxicologist. And he explained some more about cyanide, but he also, their lab, the lab that he's employed with, received 67 samples, 67 specimens from the medical examiner's office. And he works with the medical examiner to help assist with cause and manner of death by looking at blood samples for various things. So it's his job. He says, "I'm Switzerland. I'm going to look at the records and I'm going to figure out what we actually need to run test-wise." And they only ran 5 samples. One was from March 9th at 11:24 a.m. And there was no cyanide in her system on that day. But she had arsenic in her system at a pretty high level, 330 micrograms. On March 15th at 11:50 a.m., she had 68 micrograms of arsenic in her system. And he says that's still pretty high, pretty high. She also had cyanide and tetrahydrozoline in her system on March 15th. All 3. He says any one of which will kill you on their own. Because one of the jurors' questions was, do those 3 things interact with each other? Arsenic, cyanide, tetrahydrozoline. He says, no, they'll just kill you on their own, all 3. Okay. And this doctor, Justin Brown's opinion was, because he had reviewed the records, he reviewed the samples that he drew, his opinion was, it looked like a second dose of cyanide had been administered while she was in the hospital. During that hospitalization, someone got a second dose of cyanide into her system. James Craig, we think it was you. Anyway, so one of the questions the jury asked, which I thought was very intuitive, because the March 9th blood sample was before they knew about the cyanide. But what they did was they had leftover blood, so they sent that, and it tested positive for arsenic. So the question the juror asked was, do any of these toxins, does the concentration of the toxins increase over time the longer that blood just sits there? And the doctor said no. Because, I mean, I can understand why you would think that. Okay, that blood sample's been sitting there, now we're on the 16th when this autopsy's done, and you're sending the samples to the lab, and, they're not looking at them right away. Maybe they're testing them on the 17th or the 18th or even farther out, but it's not going to make a difference. That concentration of that toxin isn't going to increase over time, is what this physician is saying. So then we get the medical examiner. Dr. Kelly Lear. She said her organs showed lack of oxygen due to the administration of tetrahydrozoline and cyanide. And she also was the opinion, because she reviewed all the medical records, that there may have been re-exposure during that hospitalization due to the abrupt change in her clinical status in that time frame. She may have been re-exposed to more cyanide. So the cause and manner of death. One of the things the medical examiner's tasked with doing is finding the cause of death, which is, what immediately kills this person, and the manner of death, which is a classification. So the cause of death, she said, was acute cyanide and tetrahydrozoline toxicity. And the manner of death was homicide. So she was asked, why didn't you do suicide? Why didn't you rule this as a suicide? She is, because I reviewed these medical records. I'm her voice. I put myself in her place. She wasn't suicidal. No. And that's where the testimony ended for the day, guys. What do you think so far? I think we've got a long way to go. There's a lot more to this. We haven't even gotten into the allegations of, tampering with witnesses. We have heard that he tried to get his daughter to do the deep fake video, but we haven't heard of him trying to hire the guy to murder the detective. We haven't heard any of that yet either. But I mean, at this point in trials, sometimes I'm wavering, guilty, not guilty. I'm always trying to give somebody the benefit of the doubt. But in this case, I got to tell you, I have no doubt that James Craig poisoned his wife. I just don't have any doubt about it at all. And I think that during that alone time in that hospital room, somehow he got another dose into Angela Craig. In fact, during this testimony of day 5, one of the nurses showed the IV bag and the tubing, and she walked the jury through that. And she said when they put fluid into, if they add something, they don't have, back in my day of nursing, you would draw up a syringe and you had a needle and you'd put the needle into a little hub on the IV. They don't do that anymore. They have a thing that you unscrew the cap of the vial and you you screw it to the IV and it goes right in. So how he got this in her, I don't know. I'm questioning whether he was like, hey, did you take your clindamycin today? Where I put the cyanide inside the clindamycin pill, and maybe you should take it since I prescribed it for you, and maybe, I don't know. I'm just surmising. But there's no doubt in my mind that he did it somehow. Anyway, let me know your thoughts. I'll see you guys in the next video. Take care, everybody. Bye.